Hi, I'm Alexis Cate. I'm a licensed clinical social worker and I'm a trauma specialist. Today, I am here to talk to you about depression. Please make sure to check out the description below for all of the resources that we have linked to this video. In this video, we'll discuss the definition of depression, the difference between depression, sadness, and grief, common symptoms of depression, the different types of depression, what depression looks like in children, teenagers, and women versus men, and treatment for depression. Depression is a mood disorder, and it is often characterized by an overwhelming sense of dissatisfaction with life and sadness. Depression can affect one's energy level, motivation, and can even cause irritability. Depression is one of the most powerful mental health conditions that a person can endure. There are numerous depressive disorders, and they differ in terms of the constellation of symptoms that they have, the frequency that the symptoms occur, and how long the symptoms last, as well as the symptoms' intensity. Depression versus sadness and grief. Depression, sadness, and grief, while intimately linked, are inherently different. All of us experience sadness. It is a basic human emotion. However, not all of us experience depressive disorders. If someone loses a job, ends a relationship, or loses a loved one, sadness is to be expected. Depression and sadness, while connected, are ultimately different given the duration that symptoms are experienced, the extent to which this sadness affects one's life, and the overall intensity for which sadness is felt. When we lose a loved one or a beloved pet, sadness, anger, and despair are natural responses to this type of circumstance. However, grief can become complex after a certain point. Therefore, after some time, it can become difficult to differentiate between complex grief and depression. To learn more about depression versus sadness, we have linked a video that we've published in the description below. Classic depression symptoms belong to major depressive disorder or a major depressive episode, and these include depressed mood with feelings of emptiness, sadness, hopelessness, and even irritability. Anhedonia, which is a decreased sense of pleasure in generally enjoyed activities. A noteworthy change in one's weight or a significant change in one's appetite, either overeating or undereating, sleeping too much or too little throughout the day, feeling or looking as if you are sped up, or the opposite, looking as if you are slowed down, a loss of energy, feelings of worthlessness and guilt, and thoughts about death, dying, or suicide. Please note that if you or someone you know are experiencing suicidal thoughts, help is available by dialing 988, which is the Suicide Prevention Lifeline. It is important to note that in terms of diagnosis, not only does a person have to be experiencing these symptoms, they also have to be experiencing them for around a 2-week period. Additionally, these depressive qualities need to be impacting one's ability to function at work, home, and school. There are many different types of depression. While depressive disorders differ, they share a commonality in terms of low mood, irritability, and changes in behavior, especially with respect to negative thoughts. The main differences between depressive disorders are how long the symptoms are experienced and the timing of the symptoms and their intensity. Here are the 5 types of depressive disorders. Major depressive disorder, or MDD. This is the disorder that is commonly thought of when people think of depression. MDD is marked by 5 or more of the symptoms that we listed before, and the symptoms had to have lasted for at least 2 weeks and can vary from intensity from mild to severe. Persistent depressive disorder, or dysthymia. Rather than a period of depression that recurs and remits, dysthymia is when there is a low-level depressive mood for an extended period of time consistently, for at least 2 years, and at least 1 year in children. While the symptoms may not feel as intense, the duration is absolutely uncomfortable. Premenstrual dysphoric disorder, or PMDD. This occurs when repeated hormonal changes cause a drastic shift in thoughts, feelings, and behaviors, and this can greatly interfere with a person's ability to function in daily life. Disruptive mood dysregulation disorder, or DMDD. This disorder is more directed in terms of children and adolescents and is oftentimes diagnosed due to increased irritability and anger that is present, as well as tantruming and behavioral outbursts. Other common depressive disorders. People may experience depressive symptoms due to drug use or side effects of medication. Others may note symptoms of depression, yet not necessarily meet the full criteria for a diagnosable depressive disorder. Sometimes depression is triggered by outside sources, and at other times it can be triggered by internal reasoning, such as low self-esteem. Many aspects of depression and how it's experienced are individualized. So two people may have the same depressive diagnosis and experience the symptoms in their own unique way. This can depend on factors such as age and sex. Depression will look different between younger kids, adolescents, and women and men. For younger kids, they often complain more so of somatic or bodily focused symptoms, such as an upset tummy or a headache. Kids might also appear more clingy and have difficulties concentrating. These can sometimes be misdiagnosed as separation anxiety or even attention deficit hyperactivity disorder, or ADHD. Depression in older children and adolescents usually shifts more toward the side of irritability, anger, and defiance. They may get into more trouble at school, and they may isolate from their friends or all of a sudden have a new friend group. For women, many of the standard symptoms that are experienced are low motivation and decreased energy levels. Regardless of age, men often experience more physical problems associated with depression, such as heart disorders, chest pains, headache, and stomach issues. When a person identifies the presence of depressive symptoms, it is time to seek professional support. Though it may be tempting to address the situation alone, depression is a serious mental health condition, and it does and you do deserve professional support in going through it. Unfortunately, waiting may only give more time for the symptoms to persist and to grow. So people with depression would do well to seek treatment early. However, it is never too late to get the support you deserve. Helpful options for beginning mental health treatment include speaking to a primary care doctor, seeking the services that are within your local county, as most counties have supportive services listed on their website, searching for a therapist through an online directory, phoning a national hotline that specializes in depression, contacting a religious leader for support and a referral, and of course, communicating with your insurance company in order to receive a list of in-network providers. While every person's symptoms, triggers, and experience of depression is unique, you do not have to go at it alone. We went ahead and linked some helpful resources to support you in finding a therapist, psychiatrist, and other useful tools. Remember, you are not alone and you deserve the support.